Spot prostate cancer. Early, 7 surprising symptoms you must know. Today we're diving into a crucial topic, spotting prostate cancer early. Early detection can save lives, so it's important to be aware of the symptoms. Prostate cancer is a serious condition, but it's often treatable when caught in its early stages. That's why we're here to empower you with knowledge about the signs and symptoms to watch out for. Throughout this video, we'll discuss 7 surprising indicators that might point to prostate cancer. Remember, this video is for informational purposes only, and it's essential to consult with a healthcare professional for any health concerns or before making any decisions about your health. Let's get started. One of the earliest and most common signs of prostate cancer is frequent urination, especially at night. This symptom can often be overlooked or attributed to other less serious conditions, but it's important to pay close attention to your body's signals. This happens when the enlarged prostate begins to press against the urethra, the tube that carries urine from the bladder. The pressure can cause a variety of urinary issues that might seem minor at first, but can escalate if left unchecked. Imagine a garden hose with a slight kink in it. The flow of water is not as smooth as it should be, and you might notice interruptions or a reduced stream. The water flow is restricted, and you might experience sputtering or a weaker stream. This analogy helps to understand how an enlarged prostate can affect urination. Similarly, when the urethra is compressed, it can lead to more frequent urges to urinate. This can be particularly bothersome at night, disrupting your sleep and overall quality of life. If you find yourself waking up multiple times during the night to use the restroom, or if you're going more often than usual during the day, it's crucial not to ignore this symptom. Frequent urination can be more than just an inconvenience. It can be a sign that something more serious is happening in your body. While frequent urination can be attributed to various factors, including urinary tract infections or an overactive bladder, it's always best to err on the side of caution and consult with your doctor. A thorough medical evaluation can help determine the underlying cause and ensure that any serious conditions are caught early. Early detection is key when it comes to prostate cancer, and addressing any changes in your urinary habits promptly can make a significant difference. Regular checkups and screenings are essential, especially for men over the age of 50 or those with a family history of prostate issues. Remember, your health is your wealth, and paying attention to your body's signals is vital for well-being. Don't hesitate to seek medical advice if you notice any changes in your urinary patterns. Taking proactive steps can lead to early diagnosis and more effective treatment, ultimately safeguarding your health and quality of life. Another telltale sign of potential prostate problems, including cancer, is difficulty starting or stopping urination. This symptom can often be overlooked or dismissed as a minor inconvenience, but it can be an early indicator of more serious issues. You might find yourself straining to initiate a urine stream or experiencing a hesitant flow that starts and stops intermittently. This can be particularly noticeable during times of stress or when you are in a hurry, adding to the frustration. This hesitation occurs because the enlarged prostate obstructs the urethra, making it challenging for urine to pass through smoothly. The urethra is the tube that carries urine from the bladder out of the body, and any obstruction can cause significant discomfort and inconvenience. Think of it like trying to pour liquid from a bottle with a narrow opening. It takes more effort and might not flow continuously. This analogy helps to visualize the struggle your body goes through when the prostate is enlarged. In some cases, men might also experience dribbling after urination or a feeling of incomplete emptying of the bladder. This can lead to frequent trips to the bathroom, especially at night, disrupting sleep and daily activities. These symptoms can be frustrating and even embarrassing, but it's crucial to remember that they're often treatable, especially when addressed early on. Early detection and treatment can significantly improve quality of life and prevent more serious complications. If you're experiencing any difficulties with urination, don't hesitate to reach out to your healthcare provider. Open communication with your doctor is key to identifying the problem and finding a solution that works for you. They can help determine the underlying cause and recommend the most appropriate course of action. Whether it's medication, lifestyle changes, or other treatments, there are options available to help manage and alleviate your symptoms. Remember, taking action early can make a significant difference. Don't brush off these symptoms. Your health and well-being are worth it. Have you noticed a change in the strength of your urine flow? A weak or interrupted stream can be another indicator of prostate issues, including cancer. As the prostate gland enlarges, it can put pressure on the urethra, restricting the flow of urine. Imagine a hose with a weight placed on it. The water pressure decreases, and the stream becomes weaker. Similarly, when the urethra is compressed, it can lead to a diminished urine flow. This symptom might manifest as a urine stream that's noticeably slower or thinner than usual. You might also experience spraying or a feeling that your bladder isn't emptying completely. While a weak urine flow can be caused by other factors like dehydration or a urinary tract infection, it's essential to rule out any potential prostate problems. Blood in urine or semen, seeking immediate medical attention. This chapter is crucial for understanding the importance of recognizing and acting upon certain alarming symptoms that could indicate serious health issues. The presence of blood in your urine or semen is a serious symptom that should never be ignored. It can be a distressing sight, causing immediate concern and anxiety. This symptom, medically known as hematuria when it appears in urine and hematospermia when it appears in semen, warrants prompt medical evaluation. While it can be alarming, it's important to remember that blood in urine or semen doesn't always indicate prostate cancer. There are numerous potential causes, some of which are less severe and more easily treatable. For instance, urinary tract infections or minor injuries can also result in blood appearing in these fluids. However, it's crucial to seek immediate medical attention to determine the underlying cause. Early diagnosis and treatment can make a significant difference in outcomes, especially if the cause is something more serious like cancer. A healthcare professional can conduct the necessary tests to identify the root cause and recommend appropriate treatment. Blood in the urine, known as hematuria, can occur for various reasons, including urinary tract infections, kidney stones, or bladder problems. These conditions, while serious, are often treatable with medication or minor procedures. However, persistent or recurrent hematuria should always be investigated further. However, it can also be a sign of prostate cancer, especially if the cancer has spread beyond the prostate gland. Prostate cancer can cause bleeding in the urinary tract, leading to visible blood in the urine. This is why timely medical consultation is essential. Similarly, blood in the semen, known as hematospermia, can have benign causes like inflammation or infection. These conditions can often be treated with antibiotics or anti-inflammatory medications. However, persistent hematospermia should not be ignored. However, it can also be a symptom of prostate cancer, particularly in its later stages. When prostate cancer progresses, it can invade nearby tissues and blood vessels, leading to bleeding. Therefore, any occurrence of blood in urine or semen should prompt an immediate visit to a healthcare provider for a thorough evaluation and appropriate testing. Our bodies have a remarkable way of communicating with us, often through subtle signs and signals. Discomfort or pain in the pelvic area is one such signal that should never be ignored. While pelvic pain can stem from various factors, it can also be an indicator of prostate problems, including cancer. The prostate gland is located just below the bladder and in front of the rectum. When the prostate becomes enlarged or cancerous, it can press on surrounding tissues and nerves, leading to discomfort or pain in the pelvic region. This pain might be felt as a dull ache or a sharp stabbing sensation. It can be constant or intermittent, and it might radiate to the lower back, hips, or thighs. Bone pain, particularly in the hips, thighs, or lower back, might seem unrelated to prostate cancer, but it can be a sign that the cancer has spread beyond the prostate gland. Prostate cancer cells can sometimes travel through the bloodstream or lymphatic system and reach the bones, where they can form tumors. These bone tumors can weaken the bones, making them more susceptible to fractures. They can also cause pain, tenderness, and swelling in the affected areas. If you experience persistent bone pain, especially if you have other risk factors for prostate cancer, it's crucial to consult with your doctor. Erectile dysfunction or difficulty achieving or maintaining an erection can be a distressing symptom for men. While ED can have various underlying causes, including stress, anxiety, or medication side effects, it can also be a sign of prostate problems, including cancer. The prostate gland plays a role in sexual function, and when it becomes enlarged or cancerous, it can affect the nerves and blood vessels involved in achieving and maintaining an erection. If you're experiencing ED, it's essential to talk to your doctor. They can help determine the underlying cause and recommend appropriate treatment options. Thank you for watching. If you found this video helpful, please give it a thumbs up and share it with your loved ones. Don't forget to subscribe to our channel for more health tips and information. Remember, knowledge is power when it comes to your health. By being aware of the signs and symptoms of prostate cancer, you can take proactive steps towards early detection and treatment. Stay healthy and stay informed.